There's been a lot of exciting advances for oligometastatic prostate cancer patients. Specifically, the use of radiation therapy for these patients can confer either a survival advantage, as was seen in one of the phase 3 trials, Stampede, or at least progression-free survival benefit and overall cancer outcome benefit. And so there's been many multiple trials kind of evaluating oligometastatic prostate cancer patients and the use of radiotherapy in these patients, but there's no standardization and no consensus with how to treat them. So there's some big trials that were just treating prostate only. Some trials looked at what we call metastasis-directed therapy, so just treating the metastases themselves. And the use of systemic therapy, some of the trials included that, and then some of them were actually looking to see if maybe we could keep them off of systemic therapy. So it's really all over the place. And so we wanted to know, nationwide, how are practitioners incorporating or kind of synthesizing all the data that is out there, and how are they, treating these patients in practice? So we have a cohort of 7 institutions. And so we pooled together all the patients that are de novo oligometastatic prostate cancer patients, and we want to just evaluate how they're being treated. And so what we found, which was actually fascinating. So we also wanted to know how they were being diagnosed. So one of the things I know with all the trials and the data that we currently have for radiotherapy within oligometastatic prostate cancer patients, they have all used conventional imaging. However, the field has moved rapidly, and we really now use novel molecular imaging, specifically PSMA PET scans, to diagnose and stage patients with prostate cancer. So, that's much more sensitive in terms of imaging. And so we also wanted to know how are people kind of interpreting the data, given that, again, all the data is done or was done in a space where only conventional imaging was used, but we have really moved, and the field has really moved to novel molecular imaging. So we wanted to look at how patients were being diagnosed, how they were being managed, what was the use of systemic therapy, things like that. So in the cohort that we have, what we found is the majority of patients, about 55%, were being diagnosed with novel molecular imaging, but that does still mean a significant amount of patients were still, we're still utilizing conventional imaging to diagnose the oligometastatic patients. In terms of how they were actually being managed, it was all over the place. So interestingly, the majority of patients, the radiotherapy use, I would say the top majority of patients incorporated prostate-directed radiation therapy as well as metastasis-directed radiation therapy, and then that was closely followed by prostate-directed radiotherapy including the pelvic nodes as well as metastasis-directed therapy. So you can see it's kind of extensive and making sure that it's really broad and treating lots of different things. And then afterwards, there was a smaller cohort of patients that were just treated with just metastasis-directed therapy alone, and then finally a cohort of just prostate-only radiotherapy. So it was really fascinating to see that, again, because there is no consensus, no one is technically wrong, but just kind of trying to understand how practitioners are really interpreting the data and what are they offering their patients.